Testing, check. Testing, testing. Testing, 1, 2, 3, 4. Testing, testing, testing. Testing, testing. Testing, 1, 2, 3. Testing, testing. Testing, testing, testing. There we go. Testing, 1, 2, 3.
Test, test.
Good. All right, good evening, everyone. Thank you so much for coming out tonight for Dr. Sagha's brain food presentation. We're going to kick off tonight with a couple of quick introductions. The first one is going to be from Trinity Muscatine Public Health. I have Christy Roby here with me. She is going to speak about her program that they're offering at Public Health, the Diabetes Prevention Program. So I'm going to hand it over to her, and she'll give you a little bit more information about that program.
All right, good evening, everyone. Thank you for allowing the invite and to be a part of this presentation with Dr. Sagha. For those of you that attended his last session, do you recall the topic? Toxic, yes, and he spoke about we got all of the education in that space, and he talked about it's about understanding you were educated and make small baby step changes, small lifestyle changes. So that's what I want to share with you about a program that we have at Public Health and why we're doing it. So in 2021, we did a community health needs assessment, and the community from that got to select the priorities based off of the data. And that data came from, U.S. Census Bureau and one-on-one conversations with folks from our county. And the top two priorities were access to healthcare and diabetes. And so one of the goals in that is to reduce mortality rates associated with diabetes and get on the other side of that, which is prevention, which is what Dr. Sagha was talking to you about last time as well, and all through his sessions. So I just want to share a little bit of data from that study with you. So between 2017 and 2019, in Muscatine County, there was an annual average age-adjusted diabetes mortality rate of 51.2 deaths. That is per 100,000 population. So considerably higher in Muscatine County compared to the state of Iowa, which was at 21.6, and the US at 21.5. Huge alarm. Very concerning, which is why you as community members or others that were involved in these sessions said, we've got to focus on this, and we've got to get on the side of prevention. And so I wanted to share with you in that data also 11.2% of Muscatine County adults report having been diagnosed with diabetes. So by raise of hands, I'm not going to ask if you have been diagnosed specifically, but how many of you either yourself, a friend, or a family member have been diagnosed with diabetes, type 1 or type 2? Majority of the room. So there are sides of type 2 diabetes where there are evidence and science-based practices that can help reduce the onset of diabetes. So 10% of our county residents reported that they had already been diagnosed with diabetes. So some of you may ask, what is diabetes? Prediabetes. Prediabetes is a serious health condition where blood sugar levels are higher than normal, but not yet high enough to be diagnosed as type 2 diabetes, per the CDC. So approximately 96 million American adults, that's more than 1 in 3, have prediabetes. So if I do a quick count, That's probably, we're probably at 100 folks in this room, maybe a little over. That's 33 of us have pre-diabetes, and most of us don't even realize it. So, and of the percentage, according to the CDC, of those that don't know they have it, is about 80% of people don't even realize they have it. So having pre-diabetes puts you at risk of moving into type 2 diabetes. But the good news is, we have a program that we are offering at Trinity Muscatine in the Public Health Department that is led by the CDC, and it is the National Diabetes Prevention Program. And this is truly about making lifestyle changes to prevent that type 2 diabetes onset. So I did want to share with you, I have more information in the back. We do have, the CDC has a pre-diabetes risk assessment. You can go through this. If your score is 5 or higher, you may be at risk for pre-diabetes, or you may have diabetes. So I encourage you to stop by, grab one of these forms before you leave tonight. Susan Kruger is one of our certified trained lifestyle coaches. She is a longtime nurse at the Public Health Department. Many of you may know her. And we also have another nurse that is certified in this. So we have information. You can reach out and contact them. But I did want to share with you real quick. So some of the scoring, obviously the older we are as we age, the higher our scores get for that. Men get a point. If you're a man, you get another point that puts you at risk. If you are a woman and you have been pregnant and you had gestational diabetes, that's another point. Obviously, height and weight, I get a couple points for that in my own. So I would stop and check that out. And if you have any other questions, please let me know. Thank you so much.
Thank you, Christy. Now I'd like to introduce Dr. Williams. He is going to talk about his upcoming presentation next month on August 23rd about vein disease. So Dr. Williams, thanks for being here tonight.
Just want to introduce myself. I'm Mark Williams. I've been in general surgery practice for about 17 years. I came to this area approximately a year ago. I've been practicing in Princeton, Illinois, where my wife's hometown, for the past 16 years prior to coming here. One of the main things that brought me here was the fact that our hospital had basically closed the OR at nights and weekends, and I felt that this facility was going to be a great improvement and look at how, or actually focus on how well to keep patients and trying to keep patients in the community with the UPH system versus the OSF system that I came from. I've been in practice for, like I said, 17 years. I'm from North Carolina. I did my training down at UNC, did my PhD over at Bowman Gray in cardiovascular and cardiothoracic surgery research, then did my surgical training down in Charleston. But what brought me to this area was I have 2 boys, and I wanted to raise them and enjoyed and looked at the Midwest lifestyle and enjoyed. Thought that would be a great place to raise the boys, and it has been. So that's what kind of brought me to this area. I've had a great time so far at UPH. I think it's been a great facility. I think it's up and coming. They're expanding and making a lot of progress to keep things here in the community. One of my focuses in my practice has been venous disease. I've been doing venous work for approximately pretty much the majority of my practice for the past 16 years, looking at trying to do minimally invasive procedures and treating venous disease because it's so prevalent. About 1 in 10, 1 in 12 patients will actually have the disease in their lifetime, and it causes a lot of morbidity and problems. Typically you see the achiness, the heaviness, the itching, burning, swelling. A lot of people are underdiagnosed. They ended up turning into chronic disease and injury to the skins and ulcerations to the skin. And then chronic leg wounds. And kind of an aside to that is I started doing some wound care approximately two years ago in my practice. I do a variety of general surgery practice. So my talk is going to be on chronic venous disease and kind of understanding the whole process, trying to figure out and let people know what to do to help prevent it, and kind of explain how, what you guys would be beneficial to know from a layperson standpoint. Thank you.
Okay, thank you so much.
Now for Dr. Sagha and his presentation.
Thank you. Okay, this is the last session. 8 months we were together, and we had that journey, and this is the last one. And this is it. We are lucky to have Dr. Williams, and also I have new partner in internal medicine department. She is internist, and she had her fellowship as a geriatric medicine. And I think is a great gift for this community. Dr. Jaren Dur. I don't know how.
You're no Madonna. There you go.
Okay.
Try.
Do you guys hear me? Can you make it?
Yep, I do.
So let's go to my slides.
You should be able to just click the.
Okay. Nothing to disclose. And this is last one. We know food in this country is more divided than politics. And I had difficult time to make it very simplified. I'm standing behind what I'm saying here in general, but if you guys want to make drastic change in your diet, your primary doctors is the only one can give you the final advice. And this is excellent book. You can use that. For last 8 months, I talk about dementia and memory. I mentioned about different aspects. I came to this country in 1999. I started getting sick. Each chapter I talk to you guys about loneliness and be alone, be stressed, couldn't sleep, get sick, taking medication. I felt in visceral level. I was sick. I was fatigued. I was not able to keep myself awake. I was taking 13 medication. I was using CPAP machine. And some of you guys remember those days. And I was taking medication, was not helping me. I had significant GI symptoms, and I was taking 3 medication for a stomach, but still all the time I was in pain. I was taking 3 blood pressure medication, my nurses checking my blood pressure, and all the time my blood pressure was 200 and my heart rate was 120. I had the best cardiologist, but medication was not helping me. My cholesterol was high, and I was taking 2 cholesterol medication, and I had this muscle pain. I couldn't sleep. I had neuropathy. And finally, I ended up with CPAP machine, and I hated it. I was thinking, I'm missing something. It was 2013. I was thinking why my grandpa was more than 100 years old, and he never took a pill, and he never had a doctor, and I was in my 30s, and I was sick. That was me. I was taking this stuff. We were making coffee all days, and I was taking with cream and Splenda. Few days ago, just research came out, Splenda causing cancer. I didn't know. And that cinnamon toast crunch and milk was my favorite snack. And I was taking Activia Peach. I'm buying in bulks. And bacon, that was my favorite breakfast. I start making a plan. I was having bronchitis. My partners, they were giving prescription of antibiotic pretty much every month. I killed my microbiome. That's why I had a stomach problem. I slowly made some changes. And after 3 years, I had no medication. And I'm not taking any medication after 20 years. And I have no chronic disease. And I didn't learn it in med school. Nobody taught me. And I'm saying in firsthand, I know what I'm talking about because I had very sick body. And I had responses. And I worked on my dad, and I had responses. This is stuff I talked to you guys last 8 months. That works. It's very simple. It's not easy. You have to make a plan, step by step, slowly. Do I have those cravings? Of course I do. Do I eat a steak? Yes, I do. But if I'm making that a steak, I have obsession. What is this meat coming from? Is this organic? Is this grass-fed? And I cook it the way I want it to cook. And I eat it. Delicious. I just wanted to mention, you have power. And never is too late. And in my visceral level, I felt it myself. One thing I couldn't resist to bring this slide. This part of food we are missing. Food is not just simply food. Food has social aspect, bringing connection, bringing love, and transferring wisdom to next generation. But unfortunately, we are missing. All of us, we have responsibility to bring this part back. Few things. We all confused about food. Low fat, high fat. Low carb, high carb. Keto diet, fasting, FODMAP. And when you go to all of those nutrition conferences, the leaders in this country, when there is a QA sessions, they do not agree with each other. Some people, they say, you cannot have beans because of lectin. Some people say you cannot have meat and you have to be vegetarian or vegan. Some people, they are saying eggs is good, eggs is bad. Gluten is good, gluten is bad. And unfortunately, media is not helping us, make us confused. And today, I'm trying to make as simple as possible. I'm not labeling anything good or bad. I'm not saying lectin is good or bad. I'm not saying beans is good or bad. I'm just giving my personal experiences. In this country, when I go to Hy-Vee, if I see eggplant, I start feeling inflamed and my stomach hurts. If I make eggplants, I have problem for weeks. What happened when I was kids and my mom was making those eggplants was delicious and I had no problem? Is this the same eggplants that I was eating when I was in Iran? Definitely not. Number two, how we make that. My mom was making that eggplant. Cook it well with lots of olive oil, walnuts, mince, onion, and a lot of whey protein. So they had some anti-inflammatory property mixing with some inflammatory properties, making good delicious. That's a wisdom that we are missing it. How to cook it is very important. And if you go and see the Persian dishes for centuries, they have 6,000 years history. If you see cheese, they eat that cheese, but they eat always with walnut. Check the Google it. What about gluten? What happened? We are using gluten and bread for thousands of years. Why is coming to the surface? that we are not able to tolerate gluten. We as a human, we do not have enzyme to digest gluten, period. So what happened? We have these changes now. First of all, those glutens the Roman using in ancient agriculture, they had 3% gluten in their wheat. We hybridized it to make it more. We made 4% gluten, 8% gluten, and 12% gluten. And when our grandmothers, they were making those doughs, they had flour, they had water, they had yeast, they're mixing it, they left alone 8 hours, 12 hours, 14 hours. Those yeast digesting those glutens, we had that bread, no problem. And that bread that we are eating is basically made 2 hours, is not digested gluten, and that's why we have problem here. Maybe many of you guys cannot tolerate it bread here, but if you go to Europe or other countries, maybe you tolerate it well. It's the way they made it. It's the same milk. We are using milks for thousands of years. And some people say, who are you to tell me this milk is inflammatory? I have one question. Is this milk? Are we drinking this milk? Is the same cows with the same grass fed, or did we change it? How we are feeding those cows? Is grass fed, or we are feeding with GMO that is contaminated with all the toxins and pesticide? And did we change milk? What's the differences between milk A2 and milk A1? Old days, we had milk A2. What's the differences? Maybe they changed one amino acid they call proline, and they put histidine in, causing a lot of problem. The same time, we are pumping the cows with hormones and antibiotic, and this milk maybe is not the same milk or ancestors they were drinking. The same salt. Salt, pure white salt, is highly, highly processed. We have to go to most nature original form of food. The way our ancestors they were eating. All natural, plant-based, vegetables, fruits, nuts, seeds. What we are eating is all processed, canned, frozen, cooked, and that's causing a lot of problem. Day by days, ending to the point we have fatigue, we have lack of energy, and we have all this chronic disease. The second point I wanted to mention before talking about brain food, we have to eat clean as much as we can. Environmental working group, it should be in your phone. I have no communication or connection with them. This is a good free source for you. If you want to buy something organic, you have to know which one can be non-organic, which one can be organic. Some stuff we have to buy it organic because it's too much environmental toxins and our body cannot afford that. We have to minimize our toxic load, otherwise we get sick. The second point, when we are buying some stuff, we have to pay attention to those labels. Those labels are not just for codes and money and price. If this is 4 number, means this is traditional. Pesticide, insecticide, herbicide. It's kind of suicide. If you have 5 numbers and it's starting with 8 is GMO. If it's 5 numbers and it's starting with 9 is organic. When we are buying, look for 5 numbers starting with 9, as much as you can. I know this is expensive, but this is not cost. This is investment with high return later on. Second, GMO. You are making GMO, even Apple is GMO. They have to come up with that round label, let us know what is GMO. But they are getting sneaky, and they don't tell you. They said, if you want to know, call this number. If you want to know, text us. Or they have a QR code, you have to scan it until they disclose it for you. My point is, you have to pay attention to details, because food is everything. If you go to a grocery store, try to stay around it. Don't go to the aisle, because you cannot really find something was nutritious. As much as you can, spend some time to details. Okay, neuronutrition. What is neuronutrition? The same, we had cardiac diet, diabetic diet, now we have brain diet. And the same cardiac diet, not only helping people with heart disease, helping everyone, this brain nutrition and brain food is not just for people with cognitive and memory problem, helping everyone. And we have to work on that. We are eating our way for dementia. We are eating that meat is fed by GMO. We are eating those chicken and pigs contaminated with arsenic. We are eating those vegetables showered by pesticide. And we are indulging all of those soft drink, carbonated drink, full of sugar, full of salt, days and nights, and after years and years, we start having some pain, we start having some fatigue, we start having high blood pressure and diabetes, on and on and on. And your brain and your body tell you something, but when we go to the doctors, we are not investigating the root of it. We just simply give you that medication to suppress that symptoms and causing problem. We have to go to the bottom of it. I'm not saying I'm not giving any medication. Of course I do. I'm not saying don't take your medication. Take your medication. But at the same time, you have to work to other things to minimize your medication and make your wellness better. This is established. This is science-based. Now we have research-based data. Right side is shrunk brain because of West diet. They call SAD, Standard American Diet. The left side is brain food. If you see the right side, is all shrunk. You see more black there. This is the brain with dementia. Left side is healthy brain. This is science. We have data, and we have to work on that. And especially, we are in critical moment. We are in emergency situation. We have to work on that. Your brain is very tough. Some people say this cognitive impairment is just a matter of age. We get old. That's why we don't remember. It's not true. We are not remembering because of those punches day by day with lack of sleep, toxic relationship, a stressful lifestyle, too much stress at work, environmental toxins, on and on and on. We have punches and punches, days and nights, and especially 3 big punches, breakfast and lunch and dinner, with mini punches, with a snack and soft drink. Years and after years, your brain tolerated for 30, 40 years, reaching to the point we see grandma is not remembering things, or I'm tired, or I forget my car keys. No, we are getting punches, and we have to make it better. Your brain is very picky eater. Your brain is the same. Imagine if we are in Muscatine, if we are able to make something in Muscatine and don't import it, the same brain. If brain is able to make it stuff inside, they don't take from anywhere else. And even if you eat that, they said, I got it. I don't need it. We have to find what brain make it and what brain needs it, what is the brain requirement the most, and we have to fit that. If we do that, I promise you, after 90 days, you feel better. The brain, the same time, is very tough. The brain is very, very soft. It's 3-pound jelly, like a cheesy things, very soft and smushy. Delicate organ, most amazing things in the body. That's why they put in a helmet, in a bone. And they make a lot of different layers. They call meninges. And even they didn't want the brain hold their own weight. They put some fluid around it. They call cerebrospinal fluid to not taking any trauma. And every single night when we are sleeping, all those janitors coming to start cleaning it up when we are sleeping. And now we have the data. When you are sleeping, at restful sleep, all those janitors cleaning with lymphatic system as a waste management. This is it. It's the same heartbeat. That's why sleep is the first line of defense. We as a physician or nurses, we all paying high price to be on call and not sleeping. I paid very, very heavy price. Dr. Williams, this is for you. Okay, brain has another unique things. They have the final steps. They have the final gate. And that's unique. They said, okay, is coming into body. Before they get there, this is the final checkpoint. Blood-brain barriers. They make it very tight vascular system. Don't let anybody gets in except they have ID. And imagine it looks like a FBI. And some people, the security, they knows them. They do high five, they smile, they wave hand, and they get in. No problem. If it's a good fat, get in. If it's a good sugar, gets in. If it's a bad fat, they don't let them to come. Some of their stuff, they're friendly, come in, no problem. Some of them, they have to show the badges. They said, we are in. Some of the bad stuff, even they cannot go around it. They attack them. This is your final gate. But this gate is under control of Homeland Security. Where is your Homeland Security? Your gut, your belly. This is the main things. We as a human, we have 23,000 genes. 23,000 genes. We have bugs in our belly, bacteria, viruses, fungus. They have a community. They live together peacefully, and they have 4 to 8 million genes. We have 23,000. They have 4 to 8 million. And they are diverse. They are living together, and they are balanced. Whatever food we are taking, they grinding it, they digesting it, and they absorbing it. And they make the whole Homeland Security tight. The gates are tight. Some stuff they have to go in, they go in. And some stuff they don't go, they shouldn't go, they don't. They get out. If I make this microbiome unhealthy. I make leaky gut. The lining is not very tight. The lining gets loose. And all of those fragments, they shouldn't go in, they go inside of that homeland security. They call it leaky gut. Make that leaky brain and make memory problem. I was killing my microbiome with that bronchitis that I had every month, and I was taking unnecessary antibiotic. An antibiotic doesn't differentiate it, who is good guy, who is bad guy. Antibiotic kill it all, including my good guys. And the bad guys come in. The balance goes away, and it gets leaky gut. And everybody unwanted comes in, and blood-brain barriers trying to fight for it, but they see it's too much. They get leaky brain, we don't remember it. The first things I did, I fixed my gut. The first things, if you want to have a sharp memory, fix your gut. GI problem is number one reason people go to emergency room. Abdominal pain, acid reflux, stomach pain, diarrhea, nausea, constipation, on and on and on, diverticulitis, you name it. We all have problem. All of the general population, they have problem with normal bowel movement because we are killing these good guys. Fix this one. You have to make it diverse. You have to make it healthy. You have to make it young microbiome. If you have good microbiome, you have good GI system, you have good brain. That's why they are calling second brain. 75% of all of neurotransmitters we are using in our brain, the way we feel, is made up in your bowel. And if you remember, old days, they said, my gut told me. My gut told me. There is significant connection between GI system and brain system. Gut-brain axis. Pay attention to your gut. About Parkinson's disease, we were taught the first sign is tremor at rest. Now they are doing research. They said, wait a minute, 20 years before this guy have tremor at rest, constipation is the first sign for Parkinson. 20 years before, causing the problem. So this is important. You have to pay attention. If you have to remember one thing from all of this 8-month journey, something you are leaving today, this building, is gut health. This is it. Okay, how I make my gut-brain axis healthy? I can do good things. Number one, I have to optimize my food. If I'm drinking alcohol, I just basically burning this lining every night. You figure it out. You can have prebiotic. Prebiotic, when you give them, is in grocery list for your microbiome. They loves it, the prebiotic. What's that? Onion, garlic, ginger, all those green leafy vegetables, all good beans and good fibers. They are grinding it and digesting it, and they are making good food of it. They feed them. Good guys, they grow, and bad guys say, this is not my place. They run away. And if you don't have that prebiotic, take probiotic. But I'm very big fan of food, not just simply probiotic. If you want to have probiotic for a few weeks, that's okay, but prebiotic, fibers, and fermented food, that's why our grandparents, they were doing it. What is bad? Antibiotic. We kill them. We kill bacteria. And unfortunately, we are using in this country many, many unnecessary moments. Even sometimes for simple cold, if you go to Europe, they give just yogurt, but we give just in case Z-Pack. And if you want to take antibiotic, try to take it as necessary as possible with probiotic. From all of those antibiotics we are using in this country, 20% we are using for human. 80% we are using for animal. We have concentrated animal feeding operation. They routinely, they give antibiotic, they give hormone, and they give all of those GMOs feeding. And I don't want to make you guys upset and giving you those numbers, but they tested those meats. High percentage of them, they have bugs in it. More than 50%. And more than 80%, when they test it, it doesn't matter, is beef, turkey, chicken, it doesn't matter. More than 80% in one point, they tested, they had some contact to fecal material. The third one, processed food. All of those processed food, they have emulsifiers. They have additives. They have processed things affecting your lining and affecting your microbiome. All of your good guys run away, and the bad guys stay there. That's why all of us have problem with our GI problem. Okay, I'm trying to make it very simple what brain needs. This is brain food. If I wanted to have a brain food, few things I need to do. Number one, if I wanted to have some raw material to make my food from cement, from lumber, from workers, all of those raw materials, I need to have a nice roads. I said, brain is 3% of your body weight, consuming 20% of your oxygen, and absorbing 25% of your blood flow. That's why that vein health is important. That's why Dr. Williams basically choose to do the vein first. Because if your heart wants to pump it, they need to have some blood coming to the heart to pump it. How they come? From venous system. That's important for brain health. So you have to pay attention to your vascular system and your blood pressure. We wanted to make our green brain house with food. Let's start with concrete first. Let's pour in some concrete. Let's make foundation of this house. What is the foundation of brain food? Air and water. The most important nutrition for your brain health is water and air. If somebody is smoking in the room, run away. If it's wildfire in Canada, stay home. If you're living in Muscatine, Iowa, have air purifier in the house, the place you're sitting, the place you're cooking, and especially the place you're sleeping 8 hours. And if you want to change that filter, if you're older, let your kids do that. If you wanted to do it, put the mask on. Be cautious. Your water. 80% of your brain is water. 80% of your brain is water. Your brain is thirsty. And even in the morning when we wake up, we are in dehydration state. Even 3-4% of dehydration make us fatigue, make us foggy, agitated, nervous, and we have no energy. 3%. And even a small dehydration make our brain shrinking faster and easier, especially older folks. Because when we get older, we don't have that sensation of thirst like we were 20 years old. We don't feel thirsty. And we don't feel that we have to drink water. We get dehydrated, and reaching to the point, we get foggy. And the MRI showed exactly dehydration makes the brain shrunk. What water I'm talking about? We drinking, number 1, carbonated soft drink. Number 2, purified bottled water. Beer, milk, coffee, fruit juice, sport beverages. Is this enough? I'm not going to talk about all of those junk, all of those sugars, all of those salt, all of those processed things they're putting in. I'm just saying all of these, they're making you dehydrated. All making you dehydrated. Besides all of damages they make to vascular system. And I was Diet Pepsi guy. All the time, if you were coming and seeing me, I had Diet Pepsi in my hand. I was not drinking water. What water I'm talking about? Water should not be purified. You have to have heavy water, spring water, with minerals, heavy water, spring water, preferably on glass, room temperature, as heavy as possible, as natural as possible, but it's expensive. And if you want to have closest one similar to it, you have to filter your water at home. And you have to do some research. You have to do some homework. Which one is the best? And as I said, this is not cost. This is high return investment. Okay, next one, rough framing. What is the rough framing? If you take all of the water out of the brain, what is left, 50%, more than 50% is fat. More than 50% of our brain is fat if you take the water out. Fat is important. And for decades, they were saying low fat, low fat, low fat, low fat. We need fat. But what type of fat? 2014, they start saying, hey, we have to stop fighting with this fat. Let's eat your butter. Is this fat we are talking about? Is this fat your brain needs it? The brain needs a special fat. They call phospholipid and a sphingolipid. There is 2 types of fat. One type of fat we all familiar with, they call a storage fat. There is another fat your brain doesn't need to store, is a structural fat. They need for rough framing of the brain, they need to wrap up your nerves for sending messages, they call myelin, and they need for cell membrane, they get flexible. Those fats is important. There is 3 fats: good fat, bad fat, ugly fat. What's a good fat? Avocado, walnuts, olive oil, hemp seed, all unsaturated fat that it's rancid very easily. They're very delicate. They're very, very sensitive. The most important fat, your brain craving for it. And if you take it, they immediately using it, they call PUFA, polyunsaturated fatty acid. What is PUFA? There is a group of fat we call omega family. There's omega-3, omega-6, omega-9. 2 of them are important, omega-3 and omega-6. They are 70% in your brain. They are security system. They are structural. Omega-6, they are tactical soldiers. They are waiting there. If there is one box comes in, one infection comes in, one toxin comes in, they attack them, they hit them, they kill them, causing a lot of mess. We need another guy they call omega-3. This guy coming cleaning the mess. Omega-6 is inflammatory. Omega-3 is anti-inflammatory. Omega-6 causing fire. Omega-3 make it peace. Ratio is important. We need both. 2-to-1. American diet is 20-to-1, causing significant inflammation everywhere in our body. If it goes to vascular system, causing high blood pressure. If it goes to the liver system, causing high cholesterol. If it goes to the pancreas system, causing diabetes. All of the chronic disease is coming from mismatch between these two guys. We need to oil it up with PUFA, omega-3. Remember, EPA, DHA, these two things. DHA, most important one, 50%. This is missing. DHA is missing. How I can find it? Fish. No farm raised and no tuna is high in mercury. Even right now they are saying it's contraindicated for OB patient if the patient is pregnant. They said no tuna because high mercury. Try to have wild caught as possible, these fives. And the gold star is caviar because they have full of omega-3 and choline. If you take a small teaspoon, you have a lot of benefits. It's too expensive. The substitute for that I'm using is salmon roe. Do not forget eggs. We were hammered back and forth. Flip-flopping is good for you, is bad for you. That's a complete food. Making your bones, making your muscles, making your nerves full of omega-3, full of minerals, antioxidant, you name it. This is full, complete food. And please, talc with yolk. Bad fat. Do I eat bacon? Of course I do. But I'm looking where it's coming from, and I'm very obsessed about that. And I make it myself. Do I eat a steak?